Ciprofloxacin is a common antibiotic and it can be used for a variety of infections. In this video, we'll look at the most common uses and side effects and 11 tips you should be aware of before taking this medication. Coming up, I'm Dr. John, board certified in internal medicine as well as geriatric medicine. This channel is about promoting your health and your well-being. Think your health. Ciprofloxacin is an antibiotic and it belongs to a family of medications called fluoroquinolones. Ciprofloxacin is a medication used for fighting bacterial infections, and it does this by blocking DNA replication inside the bacteria. In this way, ciprofloxacin effectively kills the bacteria. Ciprofloxacin is used to treat a variety of bacterial infections. I've listed the most common ones on this side. One of the most common reasons would be UTIs, also known as urinary tract infections. Ciprofloxacin can be given as tablets. The doses are 250 milligrams and 500 milligrams, as well as in form of an oral suspension, especially if you have trouble swallowing. I've listed the oral suspension forms here to the side. Most infections typically are dosed 250 milligrams to about 500 milligrams every 12 hours. They can be taken in with or without food. There are a couple of infections, especially serious infections like lower respiratory tract infections, joint infections, or bone infections, which need to be treated with a high dose, such as 750 milligrams every 12 hours. The dosing might have to be adjusted if you do have kidney problems or even liver problems. The most common side effects in adults are GI side effects, such as nausea and vomiting. Musculoskeletal signs and symptoms are seen especially in children, 9 to 22%. Skin rashes are seen in 1 to 2% of cases. All medications cause side effects. Some cause mild, moderate, or even severe side effects. And there might be some individuals who do not experience any side effects at all, and there might be others who experience quite severe side effects. Please talk to your healthcare provider to inform yourself and educate yourself before taking any medication. If you're interested in how another antibiotic called amoxicillin works, click right here. Here are 11 things you should know before taking ciprofloxacin. Ciprofloxacin can be taken with or without food. However, you should not take this medication with dairy products such as milk or cheeses, as they are high in calcium. Calcium can interfere with the absorption of ciprofloxacin. Therefore, the medication should be taken at least 2 hours before you're eating these products. The same applies if ciprofloxacin needs to be taken with medications which contain calcium, such as antacids. Antacids can interfere with the absorption of this antibiotic. Therefore, ciprofloxacin should be taken at least 2 hours before taking the antacid. Ciprofloxacin has been associated with a particular kind of GI-associated diarrhea called C. difficile-associated diarrhea, causing an inflammation of your colon. You're at an increased risk if you have multiple comorbidities, immunocompromised, or an older adult, and are on ulcer medications. Usually the risk of this antibiotic-associated colitis is low at less than 1%. However, the risk is increased depending on several factors, such as duration of treatment and your overall health. Your risk is about 7 to 10 times higher, especially while you're on an antibiotic and during the 4 weeks after completing the course of antibiotics. So if you're experiencing any kind of diarrhea or sudden onset of diarrhea, especially associated with abdominal pain, nausea, vomiting, and a fever, please contact your healthcare provider as soon as possible. This medication can interact with several common medications. The list would be too exhaustive, and I've listed a couple of common medications. Ciprofloxacin can also interfere with your blood glucose levels. Reports of high blood sugar as well as low blood sugar have been associated with this medication. Especially if you are a diabetic, you would be at a slightly higher risk in terms of maintaining good glucose control. Your primary care provider will need to consider the choice of this medication, especially if it can interact with other medications. It can, in some cases, cause the timing of your electric signals in your heart to be off, causing heart rhythm problems. This is called QT prolongation. Healthcare provider might even do an EKG before initiating this medication. This medication can cause sensitivity to the sun, therefore, especially in summer, avoid being exposed to the sunlight too long, as it can cause phototoxicity of your skin. Your skin might end up looking like a sunburn. Ciprofloxacin, surprisingly, can also cause an injury to your tendon, especially your Achilles tendon. You're more prone to this, especially if you have multiple comorbidities such as diabetes, above the age of 60, and have had previous tendon disorders. If you've had some sort of tendon injury, perhaps have a discussion with your healthcare provider. Ciprofloxacin, like other antibiotics in the same family, can cause symptoms such as tremors, dizziness, and even seizures. They're associated with peripheral neuropathy. This just means that the nerves and the signaling in your nerves might be affected. After starting treatment, some symptoms you might feel are the following: burning, numbness, tingling, pain, and even weakness. Especially older adults who are on this medication, they are at a slightly increased risk of damage to a large vessel called the aorta. If you do have a history of aortic aneurysm, this medication might not be the right choice for you. Make sure you're drinking plenty of fluids while you're on this medication. In rare cases, this medication can affect your kidneys. So if you do have unusual swelling in your lower extremities, lower back pain, or have difficulty urinating, please contact your healthcare provider as soon as possible. And a bonus tip, if you do have liver problems, this medication might not be the right medication for you, as it can, in some cases, lead to serious liver problems, including liver failure. Individuals who had a higher risk are patients, especially above the age of 55. Please note, some of these adverse events I talked about earlier are rarer. However, you should be knowledgeable about the side effects, and if they do occur, please talk to your healthcare provider. And if you're interested in other videos, click right here or click right here. Have a good day and think your health. Man, this took really long. 16 minutes. 16 minutes, because I had to sit down and redo some parts of it. Okay, all done. Goodbye. I'm just going back just to see if I missed something or should say something else.